doctors to take over their wound care. But he was hesitant to do it because he knew he couldn't make any money. So now, knowing the numbers that he knows now, our hope is that he's going to take over that clinic, and things will look bright for MedPro.
Right, absolutely, 100%. I'm sharing this again. I realize I was not recording, so just so that this is on the recording, this is our what a provider would keep. This foot and ankle clinic in Oklahoma. This right margin is the column. This is what they would keep. That this would be their profit versus what the total reimbursement for the patch is. I also want to show the I've got this spreadsheet. If you don't have access to this spreadsheet, let me know. I don't want to make it public. I want to invite individuals. I've got this spreadsheet in here. This formula here is based on 30%. That chart was based on 35% discount that they would keep. This is based on 30%. And you can use this as you're talking to providers. Now, again, for those who are here in Utah, this wouldn't necessarily apply. Get with Trent or I, this wouldn't necessarily apply for somebody here in Utah. It could apply because we do have United Solutions Wound Care here. However, if we're connecting with a doctor or medical clinic or NPs that are doing wound care, and they would do their own wound care and do their own billing, then this 100% applies no matter where they're at in the United States. Free, we're wide open for business anywhere in the United States for somebody who's going to do their own wound care. I've got this the formula in here. This is on a 14 square centimeter, of course. So if we did that 4 square centimeter, remember it was $2,200 over on the sheet. This is 19. What's the difference? That's 35%. This is 30%. So, if you did a 16 square centimeter and an average patient's going to take a series of 6 patches, 6 weeks, you can see the profit margin would, for that clinic or for that doctor. Obviously, he or she's got overhead that we've talked about, but you can see it's going to be very lucrative, and that's where Tom was telling Dr. Albright, we're very confident that you're going to make money. In fact, Tom told him, this is very important, Tom told him, don't get rid of that other patch company, keep them, because it's not a one company fits every situation. Tom explained, and I want to reiterate to you, this is actually not the first time I've heard this, but I guess I just want to reiterate, these patches that Extremity Care has, as of right now, are more for, there are exceptions, but Tom made it clear, these are Medicare Part B patches. These are easily built to Medicare Part B, which the alternative is Medicare Advantage. We're still going to bill, it still can be billed or attempted to be billed, but it's more unsure if Medicare Part B, if those companies would actually pay. So that's where the provider or United Solutions Wound Care would work directly with Lisa, who's at Extremity Care, who's over the billing, to see if that particular patient can be seen. So we don't want to go out there and be professing that this is for any Medicare patient, because a lot of people do have that Medicare Advantage, that it's more on the rare side or more select that Medicare, those Advantage companies would pay. With that being said, we are working with a couple different Medicare insurance specialists that can take a patient. We have one in Wyoming right now. No, not Wyoming. We have one in Mesquite right now that wants to be seen, but they're on Medicare Advantage, which their particular companies looks like it's not going to pay for. So there's a potential that we can connect this, his name is Scott, with this patient, with this Medicare insurance specialist, to evaluate if he were to disenroll or unenroll in Medicare Advantage, re-enroll in original Medicare Parts A and B, to see if that was, make sure there's not going to be any unintended consequences. We do not, and we will not, and we're very clear, and you guys are all on the same page of doing the right thing for the patient 100% of the time. We are not going to unenroll from Advantage and re-enroll into a Medicare Parts A and B just so that the patches can be placed, because there might be other medication, inhalers, insulin, whatever it might be, that might become a lot more expensive for a particular patient. It's case by case if they unenroll and re-enroll in A and B. And so we're not just going to flock shoot and unenroll everybody. That needs to be evaluated and make sure that the whole big picture, that the patient is very aware of what would change during the treatment period. And then, depending on open enrollment or annual enrollment, when they could switch back, if they wanted to switch back to Medicare Advantage. Any questions on that?
Hey, Mark, I'm going to jump on real quick on this topic. I've got a personal friend that has her mom who it's looking like she's going to qualify for it. There's a lot of marketing, a lot of information going out right now to the general public on Medicare Advantage. And there are people that are interested in educating themselves on what are the benefits and disadvantages for different programs. And make no mistake, there are a lot of people out there that are aware that when they go to a Medicare Advantage, it really doesn't create an advantage for some types of programs or services that they want. So I would just encourage you not to be shy on and being, especially somebody who needs wound care, that Medicare B is going to be the best option for them, or being educated on it. People do want to know what's going to be best for them, and make no mistake, Medicare B for at least this particular program is going to be better serving for the patient than going to a Medicare Advantage program. So people are interested, people do want information, especially when it comes to wound care. They are definitely open to it. So don't shy away from that dialogue. I just want to add that in there. And then back to the just ASP, I just want to throw out there on the ASP price for doctors. It's been surprising to me, the more that we learn about just the whole Medicare program with wound care, that there are doctors and there are facilities and there are clinics that just don't know. And us having these training calls and being educated on different ASP prices and different products that are available, it's been a little bit of an eye-opener for Mark and I, as we've learned about that experience in Oklahoma with Vicky and those group of doctors. They're providing services strictly on what they have found to be most beneficial for their patients, and there is no return for them. I mean, if anything, it's probably costing them manpower, and they're not making any money. To have this conversation that happened in this meeting that occurred with Tom, being able to educate and bring a patch that has a reimbursement number, as Mark has shown on that graph, that actually incentivizes and puts a little bit of coin in their pocket, that's such a huge positive, because not only are we offering a better quality patch, it's covered by Medicare, and the reimbursement ASP price is significantly higher. This is just being in the trenches and just going through the network and getting to build relationships and having these conversations that'll be those breakthrough moments like Vicky has experienced in Oklahoma. So I'm grateful for these meetings. I'm grateful for the things that we're learning. The fact that Mark has been really diligent on getting this information out to you guys. We're grateful for this, Mark. I just want to say thanks for your efforts, what you're doing. But and just guys, the more that we learn, the more that we gather this information, the more we add the feather in the quiver, the stronger we're going to become. So thanks, Mark, for all the stuff you're putting out there on this. I think it's going to be great tools for us to have as we go out and have the dialogue. So I just want to put that plug out.
Right on. I appreciate that. I want to piggyback, or maybe have Cade, if you're able to talk. Cade's in this space already. Cade has a couple companies in the senior healthcare space. Cade, and this is not to bash on one part of Medicare or the other, but just as Cade's experience. Cade, what's your experience with Medicare Advantage in the conversations that you're having, your personal experience, that it's not the best thing for a lot of patients as it's being sold? Cade, any thoughts on that? Anything to add to that?
Well, I mean, when you look at it, best for the patient, yeah, it's best for the patient, but it comes with a price. So some doctors won't accept Advantage plans around here anymore. So you're like, oh, I'll see my normal doctor. Half the time you're not going to get your normal doctor going on an Advantage plan. The other part they don't tell you is as you're growing older and you need the home health or you need hospice, any of that, the Advantage plans actually don't pay the home health as well. So the fact there's 29 here, and there's only 5 that are accepting all the Advantage plans. If you look last year, there were probably half that were accepting Advantage plans, but they're losing more money every year that they're trying to get away from all the Advantage plans. Choice and Inhabit, so those like of the top 2 of the top 3 biggest in the nation, they even say with them complaining and not taking, it doesn't matter. The insurance companies like the Advantage plans because they get paid the Medicare reimbursement, but they don't pay all the way through the Medicare reimbursement. So it's just kind of cloudy water with the Advantage plans for everything.
I appreciate that, Cade, and something that we've learned in some of the meetings as we've had conversations with insurance agents, Medicare insurance agents. I've personally got 2 friends that are in that world, and they've both told me that if Medicare Part A and B pays for a treatment, we'll take these patches, which they do, Part B. Advantage plan, if somebody has an Advantage plan, they are supposed to pay as well. It's supposed to be equal cover, equal coverage, but it's not happening.
So the way it's written in that, Mark, is it's up to the insurance company. So if they deem it fit, they are supposed to reimburse the same as Medicare and everything, but it's deemed up to the insurance company to do so. So they gave the power to the insurance companies to say yes or no instead of a government agency.
Which, that's good. Less government involvement is good. In this case, unfortunately, these companies just aren't paying. They're expensive. However, what these companies are not realizing is it's a preventative care for a lot of patients that is going to prevent the amputation. It's going to prevent the continued wound care. I mean, this Scott that we mentioned, that Andy connected us with, he's had this tunneling wound for 10 years. Yes, 10 years, and it's not healing, nor obviously it's not going to heal with the current treatment path that they are on. So definitely benefits to get this treatment, even as expensive as it is. So thank you for that, Cade. Thank you for that information. You're definitely an expert in a lot of this area. There's no new news with Sean's credentialing with United Solutions, no new updates with their companies. So a question that I proposed to Sean, just to clarify, and for those who are in Utah, is why is Sean credentialing if they're not going to, if these Advantage plans, so he's credentialing to be able to bill on the Advantage plans, if they're not taking or paying, a lot of them aren't paying for these patches, why is it important that he credentials? Well, we've met with a facility up north in Ogden that wants somebody else, i.e. United Solutions Wound Care or another care company, provider company, to take their wound care completely and do their wound care. It's a home care and hospice company that doesn't want to do wound care. They want to outsource that. And so naturally, if a provider comes in and takes care of not only the patches but the complete wound care, that's going to be a feather in our cap as a company and you as a rep. Now, to be clear, we don't get reimbursed, we don't get paid on. So if XYZ company goes in as a provider and does complete wound care, we're not going to make any money on, if they do just debridement or on patients who are not on Medicare. They might have a 45-year-old that they're, helping do a wound care with. We make money on these patches when the patches are placed. However, we want to do the right thing, and we would rather make money or grow your business in a maybe 5 times a month versus 0 times a month. But yet that provider company is seeing a lot of patients on regular wound care that is not benefiting us directly, but it's the right thing for the patient because they now have access to these patches through you if they have the need for it. So wanted to and if you come across, no matter where in the United States, the same thing would be if they, just like this foot and ankle clinic. Obviously, we don't make money when Dr. Albright does something outside of the patches, nor should we. We make money when when a patient needs the patches, and that's what we can provide. So I do also want to make mention extremity care. Tom and Vicky and Megan and I had a conversation that extremity care, and I throw this out there just for a future, just FYI, just for the future. There's no timeline. It's probably going to be years. I have no idea. It could be next year. It could be 10 years. But extremity care is putting things in place to be able to have these patches be widely accepted in the insurance space, whether it be Medicare Advantage or whether it be somebody who's 35 years old who has an injury from a surgery and that's not healing. So that they're in the works. Extremity care recognizes there is a huge need out there for this, just in the general population, not just for Medicare Part B patients, and so they are actively working on, which is huge for us. Can you imagine, being able to, when that does come out in the unforeseeable future, whenever that is, that you will be able to help a lot of people heal a lot quicker, no matter what their age or their situation or their insurance is. So, all right, let's go to Q&A. What questions or clarifications do any of you have? And this is the benefit of you guys being on live, so we're glad that you are here. Any questions or clarifications from anybody?
This is Andy again. Just to kind of piggyback on Sean and the whole Medicare Advantage, is that my patient in Mesquite wants to switch over to Medicare and get this wound healed. And Sean has been great. Call. He does have an insurance agent that can call these people and try to get them switched over. So that's good news. I just got a message from Sean the other day that, hey, his agent wants to talk to my guy. So I sent him the phone number, and we'll see what we can do, because this patient down in Mesquite, like Mark said, he's had this wound for 10 years, and it's not healing. So he's excited to move forward. This guy calls me about 4 times a week to see what the progress and see what's going on. And I explained to him about the Advantage plan. He's like, well, let's just switch over. I'm getting tired of dealing with this, and I want my foot to be healed.
And that's, I want to give you, Andy, you kudos, because you're doing exactly what, this is how you do business anyway. But just to reiterate, for the patient to be calling Andy, he's got a good, close relationship with this patient. And so hats off to you, Andy, for really connecting with him and having his best interest in mind. And yes, it's taken a while as we navigate this, as we're learning about this, but great job to you for having that great relationship with him to get him the proper care. So
this is a message for Cade. This patient down here, he's looking for a nursing facility to transfer up to St. George. So if Cade could reach out to me to see if there's any options, or if he knows of anybody let me know, because this guy wants to move back up to St. George.
Call me anytime, Andy. We can discuss that further.
All right, cool. Thanks, bud.
Love that. Absolutely love that. And another point to what Andy just said there is we want to connect with some of these, with anybody in this space, even if they're not bringing us patients, because we want to, there's a concept of give to get. Okay. So if you go in a facility and just asking, just receiving, just give me your patients, but going into an organization and say, I want to learn more about your organization. So as we come across patients that could use your specialty, that we can refer to you. So exactly what's going on here, through Cade. Cade, knows quite a few of these organizations. So that's a great thing to do, is connect with these organizations to be able to refer to them and build those relationships. So what other questions? Any other questions? We got just a couple minutes.
Hey,
Vicky.
hey, Mark, I wanted to mention one thing that Tom did tell us is that they will provide a booth if we have a symposium or some kind of doctor's event, that Extremity Care will have a booth and have someone there. All we have to do is let them know.
Thank you.
Do you remember him telling us
Yep,
that?
absolutely. And so I actually sprung on him. This was last week, and Kate, I threw on him this thing that we have coming up here in 2 weeks, and he said, that might be a little bit quick. But so definitely with good notice. Thank you for bringing that up, Vicky. Let's let Tom know and see if he can work it in.
Yeah, and then one other thing was, I want to go and do a tour of the manufacturing there in San Antonio, and he did also mention that all I have to do is get there, and they'll put us up in a hotel, and they'll take us out to dinner and then do the tour. So that's an option for anybody that, would like to tour the actual manufacturing plant with Extremity Care.
Yes, I love that. Thank you for mentioning that. In fact, Dr. Albright and another doctor that Lance is working with both expressed high interest in going out there and touring the facility. So that is definitely a feather in our cap that we have. So thank you for mentioning that, Vicky. All right.
Yeah.
Anything else from you, Vicky? I appreciate your input on our conversations.
No, I'm just trying to get on the road so I can go play some golf.
She's going to Florida with Megan to go play in a celebrity tour, a celebrity tournament. So Trent and I missed that wagon. We missed that boat this year. We'll get it next year though. So anything else? Any other questions from anybody? All right, Trent. Any last second thoughts to wrap it up?
Great training today. I think it's some good information, great feedback from everyone. I think we're learning a lot. I was just going to echo what you had said, Mark, earlier about the give to get. It's been a great tool as we started listening to different facilities on what their needs are, how receptive they were to us when we were interested in, as we build our relationships and connections in this industry, in this space, that if we have somebody that may not necessarily benefit us, but could benefit one of our co-partnering relationships, we want to make sure that we keep that out there, as you've heard Andy talking about. And then also a plug too for Sean and United Solutions Wound Care on the fact that as we've expressed some concerns, or I wouldn't say concerns, but just the needs for us to offer Medicare B versus Medicare Advantage and unenrolling, the diligence that they've went through on interviewing and finding the right agent that can help us with that, facilitate that. So again, it's just an example of the working relationships that we're creating. So I just keep that in mind as you're having dialogue, is that our goal is just to be a networker, a connector, connecting different companies with each other and be a working partner with everyone that's in this space. And I think that creates long-term stability and trust. So anyway, great meeting, great training. Thanks, Mark, for putting this all together and bringing all this information out, and for everybody who participated and joined in today.
Absolutely. Thank you. Have a great day, and please reach out. Let us know what we can do. And you guys do. Everyone on here does. We're in direct communication. So thank you so much, and looking forward to doing some great things. Take care.
Bye bye.